All right, next we have the analysis of publicly reported adverse events in the VICI and Venovo venous systems by Dr. Yuchi Jam from VCU. Welcome.
Hi, thank you so much for that introduction. Although I think I will be working very hard to earn that title. I am currently a second-year medical student at VCU School of Medicine, and I'd like to thank the VESS for allowing us to present our work on the analysis of publicly reported adverse events in the VICI and Venovo venous systems. Our work Our work does not represent the views of the VA nor the US government, and we have no relevant disclosures. Stenosis and occlusion of the iliofemoral vein can manifest in several ways, the most common being May-Thurner syndrome and DVT. Venous stents are often utilized to keep these large veins open once balloon venoplasty has been employed and have been found to prevent symptom recurrence in up to 70% of patients. The Venovo and VICI venous stenting systems were both approved in 2019, each with excellent results in their clinical trials. However, they were both recalled in early 2021. For the VICI stent, it was due to migration, and for Venovo, it was because of expansion failure. Okay. The FDA MAUDE Database is a resource that compiles all reported adverse events related to medical device use in the past 10 years. It includes reports from manufacturers, importers, device user facilities, as well as those submitted by health professionals, patients, and consumers. Our objective was to examine publicly reported adverse events in the MAUDE database to better characterize predominant device and patient issues associated with the VICI and Venovo stent systems. We queried the MAUDE database for medical adverse reports related to both stent systems starting from their FDA approval dates and analyzed them for device issues, patient complications, interventions done, as well as device return status. There were 341 reports found for Venovo and 50 found for VICI. Some reports were associated with multiple different events. Notably, the VICI system, which was recalled due to issues with stent migration, did have this as its most commonly reported device issue, while Venovo stent system reports were predominantly related to device deployment. Fracture was also a significant proportion of reported issues for both systems. For both systems, the majority of cases experienced no clinical symptoms or consequences. However, Venovo did show significantly higher percentages compared to VICI. A small portion of cases experienced adverse signs including pain, dyspnea, swelling, and thrombosis. The reported interventions include ballooning, stent extraction, repositioning of stent, utilization of a new device, and stenting over the previous stent. The majority of reports did not specify any interventions. There are several limitations to our study. The first being that it's a retrospective study. So there was no randomization, and therefore all results are solely based on association rather than causation. In addition, the MAUDE database does not account for all procedures performed using each of the stent systems and is subjected to information bias as well as over and under reporting. The small rate of device return also means that device malfunction was not verified by the manufacturer. In conclusion, there are significant differences between the VICI and Venovo systems in terms of reported device issues, patient injuries, and interventions. Standardized reporting of these factors will greatly improve monitoring of adverse events in vascular devices. Thank you very much for your time, and I look forward to any questions you may have.
All right, well, we wait for some questions from the audience. So it seems like these, I haven't personally looked into these MAUDE data, but it seems like it's quite limited as to what can you obtain from that. Do you have any information about reinterventions or what these patients had to, if these patients had to have any kind of further procedures down the road after the first failure?
Unfortunately, there are a lot of inconsistencies in terms of how reports are done on the MAUDE database, and so and actually that's something that we actually recommend, and that is to improve this reporting system so that we can get more information and better be able to analyze these type of data in the future.
All right. All right, thank you. Good job.